Welcome, everybody. I'm Dr. Nafysa Parpia.
And I'm Dr. Eric Gordon, and just glad to have you with us. Today, we're going to answer some of the questions that came up in our webinar on peptides. They were a lot of interesting questions. I'm going to start off just with Dr. Nafysa is going to talk about Lyme protocol, because that was a big one, and why we have difficulties with protocols.
Right. So we were asked about all kinds of protocols, actually, not just Lyme, but we were asked, is there a peptide or peptides for long COVID? Are there peptides or protocols for Parkinson's, as well as tick-borne disease in general? So we want to talk to you today about why we don't do protocol-driven medicine. So anybody who suffers from a complex chronic illness has a combination of immune dysregulation that leads to inflammation. Now, that plays out differently for each patient. No one gene is responsible for the same diagnosis in different people. This is really important to understand. In almost all of these acquired complex chronic illnesses, including chronic Lyme and any post-infectious illness, any neurological disease, including Parkinson's or ALS, for example, there's not one gene that everybody with the same diagnosis has. We can have many different genes at play in different individuals, which can produce the same diagnosis in different individuals. This is a very important concept to understand, because in the medical establishment, it's often thought that it's that people are sick for the same reasons. Now, these patients have a multitude of different exposures. They're not sick for the same reasons. The different exposures can be, actually, I'll let you talk about those, Eric.
Yeah, well, just we all talk about Lyme and the other tick-borne illnesses and the persistent herpes viruses, the big ones being EBV, CMV, and AHH6. And of course, the toxin load, which is something that has become more and more of an issue, more and more of a stress on all of us. Just think from the glyphosates that are everywhere, the microplastics, and probably the EMFs are making life a little harder for these bodies that were developed before we had all this. And of course, there are the physical stressors, how you carry your body, how much time you spend on a computer screen. And if you start off with the genetics for a little more lax ligaments, that seems to be tied to the same genes that can, and when we say genes, the same groups of genes that can maybe produce a little bit more inflammation. And then you have issues with old injuries that will interfere with drainage, and that means that your lymph gets stuck in places, and that also can increase local inflammation, which can then feed back and just keep your body in a little bit more inflamed state. And this total amount of inflammation can eventually lead to a chronic illness in your body.
Right. So these different causes are interacting together in each individual's body, and that stimulates hundreds of biochemical and genetic variables that then act in a coordinated way to then cause an ultimate cause of illness.
Yeah. And so the thing that's, I think the simplest way to think about that is something we talk about often, that, we often talk that the medical establishment is very good at treating acute disease, okay? And that's because basically treating acute disease is to suppress the symptoms to allow the body to heal. And so therefore it's easy to have a protocol. We give A, B, C medicines, okay? Now, when we're dealing with chronic disease, again, it's about the totality of what makes you, you.
And that's the ultimate cause of the illness.
What makes you, you, and your interaction with the environment. And when we're using peptides, we're actually the peptides don't suppress inflammation. They are helping signal your body to lower inflammation as part of a process, rather than just throwing a wet blanket on the whole thing.
Right. And then this is why we don't have protocols for disease processes. When you're suppressing symptoms, you can have a protocol for illness. But sorry, when you're suppressing symptoms, you can have a protocol, but for illness, you can't really have a protocol, especially when it's chronic. So bearing this in mind, we have a general approach for treating tick-borne diseases and any other complex chronic illness. So we know this. Oh, you want to go ahead?
No, you riff with this. Yeah,
Okay, so we know this. The immune system is dysregulated. We see it on the labs. We see it in the patient's presentation. The patients are in a state of inflammation. They've got high inflammatory chemicals. Again, we see that on the labs. We see it in the way that they present.
And one thing I just want to emphasize here is that the labs you have to look at are more than just looking at the C-reactive protein and the sedimentation rate and the white blood cell count, because that is what the conventional doctors look at for inflammation. And those are markers of inflammation, and also perhaps an elevated anti-nuclear antibody, but they are only a tiny part of the signals that your body can give to show that it's inflamed. And those are often normal in many people with chronic inflammation, especially the chronic tick-borne diseases. So there are many more tests that need to be done.
I'm really glad you brought that up, actually, because that is true. The standard labs, it's not enough, right? So we're doing a deep dive in their biochemistry in order to understand this. So,
and that's something we will do a webinar on one day, is the testing that can be helpful to give you a more complete idea of whether you in fact have inflammation. And I'm going to go, one of the questions that was put there is, someone asked if inflammation is a bigger driver of insulin resistance than sugar. And it's an interesting question, but the truth of it is that there are people who can eat a lot of sugar and don't develop insulin resistance. There are many people who look like they should be diabetic. They're, they carry a lot more weight than we think people should be carrying, and maybe their diets aren't very good, and they do not have insulin resistance. Okay, and there are many skinny people, okay, who are insulin resistant. So, if you have insulin resistance, eating sugar is definitely going to make that worse, okay, or any simple carb. But the insulin resistance is often driven occasionally by genetics, and there's always a component, but inflammation is what increases fatty acids inside your muscle cells, and that directly interferes with with insulin signaling and creates insulin resistance. So just an aside. That was one of the questions that somebody threw out there.
I think another good question, it's a good segue, is what are the best peptides for general inflammation? So we did talk about this on the webinar, but we're going to give it to you again because quite a few people still wonder. So KPV and Amlexanox have a direct effect on the mast cells. KPV, also if the monocytes are too high, it's going to help bring them down. Usually that means that there's bowel inflammation. If you see the monocytes too high, yes, giving KPV is going to be helpful, but you do want the doctor to do more labs on looking for bowel inflammation. Want to investigate that. KPV also has anti-inflammatory effects. It's a regulator of normal immune balance and mast cells, along with those antimicrobial effects. Do you want to talk a bit about Amlexanox?
No, Amlexanox is a very interesting one because technically it might not be quite a peptide, but it's one that we have found to be very helpful in quieting down inflammation. It inhibits release of histamines and these leukotrienes, these other inflammatory chemicals from the mast cells and basophils and neutrophils. These are all your basic innate immune system cells. And it also has a nice effect on decreasing insulin resistance, probably again by lowering inflammation. And what is very helpful in resolving chronic inflammation is that it gets some of your immune systems to die off in a process we call apoptosis. And because that is one of the reasons that we stay stuck in inflammation, is the kill switch is not being thrown in some of your immune cells. These cells should not live forever, at least many of them. You could hit the BPC.
Oh, okay, so BPC 157, this is one of the big peptides. It's been studied for decades. It's used a lot by people. Actually, doctors just starting out using peptides. It's the go-to for good reason. It helps to bring inflammation down in the gut and in the rest of the body. It was first found in human gastric juices, and it was found to help people heal from ulcers, but it also protects and heals an inflamed GI epithelium, meaning it helps to heal leaky gut. It protects the liver from toxic insults like alcohol, or too many antibiotics. It's a free radical scavenger and has neuroprotective activities as well.
And somebody asked a question, I think it was about BPC, should have that list of questions, but about it affecting TH17. And I'm not aware of it affecting TH17, but one of the important things is it's an immune, it's like all these immune modulator, and it helps increase nitric oxide, which helps our blood vessels relax, and again lowers inflammation. It helps tissues heal. It's also been used as Dr. Parpia was saying, in healing the gut, inflammatory bowel disease. So it's very good. And the reason I brought up the TH17 is don't get too hung up on, you read one, TH17 is bad, or, we have a tendency to pick up molecules and say they're bad. None of them are bad. The only question is always about balance, whether they go up like they're supposed to and then go down again. So an intermittent elevated TH17 is not a problem. It's a problem when it stays elevated and it continues to turn on that pro-inflammatory persistent response. So, the other little thing about BPC 157, it might actually help lower VEGF, which is one of those things we see go up in post-COVID quite a bit.
Okay, now about TB4 frag, it calms the immune system. It stimulates the production of T cells. It's essential for protection, repair, regeneration of tissues. It lowers the inflammatory cytokines. So it also impacts multiple neurological pathways in recovery. So it reduces inflammation, angiogenesis, neurogenesis. It makes those things happen. It increases myelination. So it really helps the nervous system repair more than most other things do. Now, these are the peptides that we use mostly for immune modulation. I want to weave it back into why we don't do protocol-driven medicine so much. So we'll start here by modulating the immune system, but there's a lot more that we need to do for the individual. So once we've begun modulating the immune system, we can then start working on the trigger. So we'll do an entire webinar on this, but I just want to make it very clear that we will use these for most people in complex chronic illness to begin with, to start to modulate their immune system while we begin to work on everything else that is making them sick, all those different insults for the system that Dr. Gordon mentioned earlier, the multitude of infections, the structural integrity issues, the environmental toxins, stress, whether it's physical, emotional, spiritual. So we're tying everything in together.
Yeah. And I think I'd emphasize here again is that this is for people who have, reached that point where they have a chronic illness. Not every time you get, you get an acute infection, you don't need to take all the peptides. Okay, it might help a little bit here and there, but generally your body's going to deal with these things pretty well on its own. These, the use of these, I think, are most important when the system is stuck and you're trying to give it the healing signals that it needs.
Right, and this is where we've really taken peptides to most people, most doctors, practitioners using peptides. It's for optimization. It's for longevity, which we think is very, very important as well. But most of our patients, all of our patients have complex chronic illness. And so we're talking about peptides in this context. Yeah. Someone asked about a peptide that's good for muscle or nerve pain or central sensitization. Eric, do you want to talk about ARA?
Well, yeah, ARA 290 is an interesting one. One of the things that it brings up is the thing that other people, the big question that people ask us is where to get these things from, and ARA 290 is one of those that's not that's difficult to get, at least in California, because the pharmacy boards in different states do control what peptides can be produced. And it's hard to get a lot of them in California, but the ARA 290 is a really interesting one. It's a derivative of a medicine, of a chemical, actually, a protein called erythropoietin. This is something your kidney makes to tell your bone marrow to make more red blood cells. So it's a very important part of the body. And but ARA 290 is a piece of it. The reason we use a piece of it is when we use the whole molecule, people develop occasionally antibodies to it, or might make too many blood cells. This being a piece of the larger protein, just gives the message, one of the healing messages, and it helps nerve tissue repair. Okay, and it turns on something they call the innate repair receptor. So every once in a while they name things appropriately in medicine, but anyway, so this helps shut down systemic inflammation, but more importantly, really works on the inflamed nerve itself, and has been found to be very useful for peripheral neuropathies. Now, I should say, again, when I say very useful, there's really only a handful of studies in humans, because again, these studies are not supported by pharmaceutical companies and they're expensive, so people don't pay to do them, though there's a lot more studies on all of these peptides in animal models, which is helpful, but nowhere near as good, because what they do in animals is just a hint. We really have to see how they work in people. But so this is a very good one for people with peripheral neuropathy. It's just, unfortunately, in California, we can't get it right now. Hopefully that will change soon.
Thank you. There's a question. How do you address the psycho-emotional issues that underpin disease? And are peptides just another way to avoid dealing with these deeper dysregulating issues? So in our practice, we're working with the whole person. Any medicine, when used on its own in complex chronic illness that addresses only the biochemistry, is going to do that, which is wonderful. But we do realize there's an entire human being sitting in front of us. So in our practice, we never use medicine, whether it's peptides or anything, to bypass what's going on with the human that's sitting in front of us. So we approach each patient with an open heart, with love, and we listen to each patient. It's amazing the things the patients will tell us. Everything, and that comes from a loving, trusting relationship, and of course there's that, but a lot of patients might be doing therapy, or they might be following their own spiritual path, which we think is important. Whatever note hits you is important. Grounding, spending time in nature.
Yeah, the way to heal the body is to give it the signals that life is safe. And so yeah, being in a loving environment is really important, as best as we can do, and being in nature, because being in the sun, stepping on the earth, these are the simple things that really allow healing. You can take all the medicines and all the peptides in the world, but if the body doesn't feel safe, the path to healing is going to be more difficult.
So we do a lot of work around having the person feel safe in the spirit, in the mind, in the body.
Yeah, and on a more mundane level, I just want to hit. There was like 3 more questions that I thought were really useful for other people. Okay, for all of our audience. Several people asked about, how do you measure mitochondrial function? And well, Probably the simplest way to get a hint at it is a test that you can get at LabCorp or Quest, just looking at your pyruvate and lactate. And when the mitochondria are working well, when the mitochondria are not in the stress mode anyway, you're going to find that the pyruvate that the lactate is low relative to the pyruvate. And it's something that every doctor should be able to interpret this test for you. And it's available at LabCorp. And it's a good first check. If it's normal, doesn't mean that your mitochondria are functioning wonderfully. But when it's abnormal, you know that there's really an issue and that you should be talking to your doctor and exploring more. Now, the other very interesting one is where to inject peptides. On your abdomen, on your thigh, on your arm. And it's not that any one place is right or wrong. And it's just in general, these are subcutaneous injections. And the subcutaneous tissue is different everywhere, and the blood flow is different everywhere. Usually we prefer the abdomen because that way the blood flow is least affected by your activity levels. But you can inject almost any peptide anywhere. It's just that if you put it in your thigh and you go out running, you're going to have a much more rapid absorption. And whether that's good or bad, I can't tell you. You'll just depend on what you're trying to accomplish. So generally, we advise injecting it on the abdomen, but there's no problem injecting it into the thigh if that's easier for you. Just be aware that activity level will change the absorption. And the other question is these things on empty stomach or full stomach. And basically, it's better to take things that you don't want the body to break down quickly on an empty stomach. However, and that's generally what to do. But I say is that if you forget and you happen to have a meal, and you're having good effects with the peptide, you might want to take it anyway, because you still get some effect. And you have to be careful, because sometimes that desire to be perfect gets you to do nothing. So what's that great saying? Perfection is the enemy of the good. And it's the same thing here. Getting 50% of the benefit is better than getting no percent.
Yes. Well, that's it for now.
Yeah. So thank you all. We look forward to doing more of these, giving more information, and as I said, telling you more and more about what things and what tests that you can be using to help you work with your physician and maybe get back to health, which is where we're all looking to go. Stay healthy.
Thank you for joining us.